Hi, I'm Dr. Jennie Byrne. I'm a psychiatrist at Cognitive Psychiatry of Chapel Hill, and I'm here today to talk to my primary care doctor colleagues about a question that I get quite frequently, and especially when I worked in the hospital on the consult service. And that is, how do you handle the crying patient? And I don't just mean crying in general. I mean the situation where you're sitting in the office, you've had your appointment, you think all's well, you're writing the prescription, their hand is on the doorknob, and all of a sudden the tears start to gush, and they start telling you about the most terrible story you've ever heard. Something terrible has happened to them or their family member, and you know that you have 5 exam rooms down the hall waiting for you, and you have no idea what to do, and you feel trapped. You want to be empathetic, you want to listen, but at the same time, you know that this is going to open kind of a can of worms, and you're not going to be able to close that can of worms in a good amount of time. So what do? Unfortunately, a lot of the doctors will just say, we'll have to talk about this later, and kind of push the person out of the door. And often what I see is doctors will really try to sit down and listen, but that often takes half an hour, and that really throws off the doctor, and it's hard to concentrate on what someone's telling you when you know you have 20 other things to do. So I don't really think that's a good solution either. I have a trick that I want to share with you on how I handle this situation, because it happens in my office. Even though I've been talking to someone for 45, 50 minutes, often the tears and the hand on the doorknob happens to me too. And I need to be on time too. So what do I do in those situations? The first thing you do, let them talk just for a minute, and then try to pick a pause and ask them this question. What was the worst part of that for you? And the reason you say this is you're gathering all their scattered thoughts and emotions and forcing them to kind of focus and give you one thing. And that's the most terrible part of this. So then they'll say something to you like, well, the most terrible part of this was I felt out of control. Then the next question you ask them is, how did you cope with this? And again, this takes them from the mindset of the tragedy and reframes it a little bit into something more positive or forward-looking or coping. And maybe they'll say to you, well, nothing really works, but I know if I talk to my friend, that'll help me a little bit. And then I say, hearing you say this makes me feel something. And that needs to be a genuine emotion. So if you hear a terrible, tragic story and it makes you feel sad, you should say, hearing your story makes me feel sad. If it's a terrible story of abuse, maybe it makes you angry. And you say, hearing about your situation makes me feel angry. And by putting the situation back into your shoes and how you're feeling, you're showing them that you are empathetic with them, but you're not pretending to understand their situation. So a common mistake I see doctors say is, oh, that must be sad for you. That must make you feel angry. And you don't really know what's going on in their mind. If someone says, oh, my father died, and they're crying, you might say, oh, that must be terrible. You must be so sad. And maybe their father, was a terrible person who abused them. And maybe they're not feeling sad. So you don't want to make the mistake of saying, you must feel this way, because you don't really know what they're feeling. But if you say, I feel sad listening to you, that's a valid, empathetic statement. So again, if you have someone crying, hands on the doorknob, try this trick. Try saying, what was the most terrible part of that or the worst part of that for you? Then ask them, how do you cope with it? And then make a statement about how you're feeling. Hearing you say that makes me feel sad. It doesn't always fix the person's problem. It doesn't always get rid of their emotion, but it does tend to kind of focus the conversation and tone it down. And if you feel like they're still really upset, you might want to add something like, would you like to come back in a few days and talk to me more about this? Or would you like my nurse to refer you to a counselor to talk to? And that way you've spent a few minutes, you've heard the person, you've showed that you're empathetic, but you've also kind of moved it along so that you're not stuck in the office half an hour stressing out and you're not pushing them out the door. Anyway, so that's my trick for the crying patient with their hand on the door. I recommend you try it. And if you get stuck, I'm here. I'm happy to help. Please just contact me at the information below. Good luck.